I'm really excited about the undertaking of the Care Operating System program at IHI, and I think it can close a pretty big gap that's existed really since we first started to understand the sciences of improvement and how they can apply in healthcare. Our systems are not today achieving what they really can at current cost levels, and maybe even lower, because the designs are wrong. The performance of a complex organization like a hospital fundamentally does not depend on individual people trying harder. That's just wrong. The what is a scientific view of what a system really is, especially in the context of healthcare, and what we can do through design and redesign of that system to actually allow normal, good, well-intended people to do far better together in their work than they may ever have imagined before.
If you put great people and great technology and great institutions in suboptimal systems, the systems will suboptimize those great people and great technologies and great traditions. And there is an opportunity for us to progress the system from what I would call analog clinical quality towards a system that's more digitally enabled and leveraging the best of the technologies that we have today to actually move this forward. We have to increasingly move our quality apparatus from being reactive and retrospective, by which I mean we have this fountain of data that's flowing in the wrong direction. We have to turn the fountain of information in the other direction, from the boardroom and leadership room back to the frontline care teams, giving them the power and information available to actually change practice fundamentally in their environments. The Care Operating System fundamentally is about improving systems, not about fixing the people. The people in our systems are brilliant, are hardworking, determined individuals. That's the story of healthcare in many ways, but we have not necessarily given them the tools that are readily available in our systems, but we have to make them available to them to allow them to get the best out of their systems today. Technology, in my view, is the way in which we help people work smarter. And we do that by making the technology actually work harder so that our people can work smarter. The Care Operating System and the technology-enabled clinical workflows that we're describing help to manage that entire change process and create value for the systems, both in better outcomes, better care experiences, not just for the patients, but also for your staff, and ultimately all of this happening at a much lower cost basis of care.
The Care Operating System model, the approach that IHI is developing and wants to support, is how to convert the sciences of systems into the daily work of leaders, managers, boards, and the frontline worker. I think the potential is enormous. Care gets more reliable, easier to engage in, the workforce better able to enjoy its pride and joy, and costs will fall. That's the promise of the Care Operating System model. It will achieve results far more than we could possibly imagine with the impoverished theories of the past.